Many of the severely injured from Whakaari White Island remain in burns units around the country and will face months of treatment. Dr. Peter Watson is the Chief Medical Officer of County's Manukau Health and joins us now. Good evening, Dr. Watson. I'm wondering, could you start by just giving us a bit of an update? How many people remain in New Zealand hospitals and what level of condition are they in?
Sure, thanks, Lisa. As of now, we have transferred 13 Australians. That's all of the Australians who are in our hospitals who survived the explosion back to Australia. So that's been really important to be able to do, to return them to be close to their homes and families, and also to really take the pressure off our New Zealand burns units. So in New Zealand burns units now, we have 15 patients. 11 of them remain in a very critical condition with extensive severe burns. So that's the state, and that's across Waikato, Hutt Valley, Canterbury and counties here where we have the National Burns Unit.
Can you put it into perspective for us? Generally speaking, I mean, how many surgeries might some of these people have been involved in since Monday?
Well, generally, at this point, though, at least a couple of surgeries, but it's completely dependent on their clinical presentations. But these surgeries, as they start to stabilise, generally every second day, but again, it depends. But this has been a really long working week for all of the surgical teams, the intensivists and the burn surgeons and the nurses, etc. And I'm pleased to be able to say, at least in our hospital here at the National Burns Unit, we have, for the first time since Monday now, not any scheduled operations overnight, but of course that can change. But again, it will continue through the weekend, and we're getting to a stage now where we're also having new surgeons arrive. So we're in a very fortunate position to be able to have overseas burn specialists approaching us and offering their support, and the first one has arrived and will be joining our teams tomorrow, which is going to give much needed relief to our teams.
So where has that person come from, and how many more are you expecting?
So the surgeons come from Australia. We're expecting some more from Australia, but we've had inquiries and we're looking to also bring others from further afield. But at this point, we're processing and we've been working as fast as we can to get all the paperwork and all that done. But we're really pleased that the second person we expect to be joining us over the weekend. And what we're going to do is we're going to plan this out now over the next weeks and months, because this will be, for many of these people, a long period where they require further surgery and further intervention. Furthermore, a number of the people will be stable enough to be able to transfer back to their countries of origin as their clinical situation improves. So we'll be able to do that again, not immediately, but in the coming weeks.
You mentioned that tonight's the first night where you won't have surgery involving people from Whakaari White Island. So are you saying since Monday you've been operating a 24/7 surgical theatres to deal just with these patients?
Yeah, and that's alongside all our other hospital business. You know, we are a really busy hospital here at Middlemore, as people will appreciate, as our other hospitals. So this is on top of our other work. But we have had teams, our surgical teams, with our burn specialists and the wider multidisciplinary teams working 24/7 all week. But we've also been coordinating the response across the country and with Australia. And as you might imagine, that's been an enormous effort. And I'm just immensely proud of all of the incredible work that these people have been doing. They've done an amazing job in facing really challenging and complex medical conditions as a result of these burns that these people have suffered.
Given the volume of work that you have you been able to do all your elective surgeries, or have you had to put some of those off?
We've had to put some off, but we've also now started to work with our other here in Auckland, not necessarily in the other places, but here in Auckland we've certainly started to work with our other DHB partner colleagues, so they're actually picking up some of our work as well. So again, amazing coordination really across a system which has really been able to pull together, and people have all been really willing to be able to essentially pitch in and be able to do the work that's been required.
So how many surgeries have you had to cancel as a consequence?
I can't tell you the numbers at the moment, and they've been postponed, but we'll be looking to pick up that work, but also the other work that needs to be done. But we're working into Christmas and the New Year, so it's a challenging type of year to be doing this, but we have got the full support of our neighbouring DHBs to assist us with this work.
And what kind of help are your staff getting?
While the psychosocial support for our own staff is not to be underestimated, this has been hugely stressful. Beyond supporting the families, obviously, that we are now having extensive support in terms of welfare support and psychological support for our staff. But we've also been overwhelmed with offers from the community. People have been donating all sorts of things, and including amazing deliveries of amazing food and other supplies to the hospital. I've been personally taking numerous phone calls, people willing to offer, all manner of things to help us through this, and it's been remarkable, really, how New Zealand pulls together to support, the hospitals facing this situation, and our teams are doing their utmost, and we really want to thank everybody for supporting us.
This is, as you said earlier, really the beginning, because treatment like this continues for some time. How long do you anticipate that you will have this increased demand on services?
Well, we expect a number of these people to be in our hospitals for weeks, and then for some of them to be able to return, but for some of them that's a long journey back to the UK or Europe, so they will have to be significantly better before they can be moved. But we would expect any one of these patients with severe burns to be requiring hospital for several months. These are long-term patients in our intensive care and our burns units. But again, as we are able to support them to go home, which again I want to say is really important, because they'll be able to be with our family in their own communities, and we'll do that as we can. We will have and be able to do that as their condition permits. We have 2 New Zealanders in hospital, so obviously they'll stay with us.
Thank you so much for your time this evening. That's Dr. Peter Watson, who's the Chief Medical Officer from Counties Manukau.